Whether you're providing mild to moderate sedation or general anesthesia for your patient, you want to have an ability to establish a surgical airway in case you're unable to establish a supraglottic airway, whether you're using an LMA, an iGel, or if you're going to intubate. One of the ways to do that is with the Quick Trach 2. It's basically a quick way to perform a cricothyrotomy. Here's the kit. And here's what the Quick Trach 2 looks like. Basically your needle, as well as the cuff and an introducer. There is a 5 cc syringe to aspirate. This would be filled with some type of fluid like normal saline to make sure we're in the membrane, or we're in the airway. And there is a way to inflate the cuff. Remember the anatomy. You want to search for the Adam's apple, which is the prominent portion of the thyroid cartilage. Directly caudal to that is the cricoid cartilage. In between is the cricothyroid membrane. And the Quick Trach is introduced directly at a 90-degree angle into the airway. Check and see how the Quick Trach would look. Let's pick up a scenario where we are unable to ventilate with bag mask ventilation. And we know our patient has some trismus and it's going to be a difficult airway. We're unable to actually even establish an airway with intubation. Let's see how the Quick Trach would work in an emergent situation. I've got an oral pharyngeal airway in. I'm trying to bag mask ventilate. I'm not seeing any chest rise. Let's see if the Quick Trach will help us here. We've got our Quick Trach. We're going to introduce that directly at a 90-degree angle below the thyroid cartilage and above the cricoid cartilage. Directly at a 90-degree angle. Here, at this point, we can aspirate. We should see air bubbles, then we know we're in the airway. There is a red plastic guide piece that would be removed. And then much like you could use a pencil and you would push a pencil in, we can remove the introducer and advance the Quick Trach. At this point, we want to inflate our cuff. Once the cuff is inflated, we can take our bag mask, attach that to the Quick Trach. We should start to ventilate. We should be looking for a chest rise. Remember too, we can check our bag mask. We want to be in our safe zone around 20 to 40 so that we're not ventilating to cause barotrauma. That's the Quick Trach 2, and that's a way to establish a quick cricothyrotomy for a patient who's apneic that we're unable to ventilate for and we can't establish an airway for any other way. Thank you.